weight-related issues have always been weighed in kilograms, unfortunately, and it was not weighed as body mass index. The correct thing is that we calculate our body mass index not in kilograms, but in the figure. And that I feel that most of the time people just tell about their weight, which has got no relevance unless we have the height in square meters, and that's how we can calculate. So the most important thing is the BMI has to be calculated. With the stigma which has come with obesity has been because of the morbid obesity, super obesity, and super obesity. But unfortunately, it carried down even for overweight people. So I feel that the stigma has been incorrectly leveling even the normal so-called overweight people into the obese category. So the most important thing in this field of bariatric field is to calculate the BMI. And unless we calculate the BMI, we cannot actually quantify the stage of a disease. We cannot quantify what needs to be done, because all stages have different approaches and different ways to help them, different ways to treat them, and different ways to manage them. We must understand that the obesity, morbid obesity, is not only, the patient is not only responsible person for that, as we generally tend to blame them that आप बहुत खाते हैं और exercise नहीं करते and you are a lazy person. I think we should not blame the patient for that, because there are multiple factors which are responsible for obesity. One important factor, of course, which neither the patient nor we can change, is the genetic coding of that person, coming from the mother or maybe father or both. And also we have seen that the genetic coding can travel up to 7 generations. So even if the parents are lean and thin, in some generation there may be obesity genes which the person must be carrying. So that is one important factor. Then there are 2 commonly discussed factors. One is the eating habit, of course, and another is physical activity, exercise, or for that matter, burning the calories. I feel there is another third factor which is responsible, and I have been actually shouting on top of my voice that please give some importance to the sleep pattern. It is a tripod. The cause is tripod, and intake is important. The output and burning the calories is important, but also is very important is the sleep pattern, because while we are sleeping, the enzymes which are secreted, they are quite different, and they are the satiety hormones that keeps the hunger under control. But when you are awake, when you are working, then there are, hormones which are ghrelin. It stimulates the appetite. It makes you hungry. So if you are awake at night at 2 o'clock or 4 o'clock, you continue eating. And of course, what is available at that particular time is simply the junk food which is available, which has got a high calorie. So I would like to say that if keeping genetic predisposition as neutral factor, then we are left with 3 factors: your intake, how much calories you are taking; second, how much you are burning; and third, how well you are following the normal biological rhythm of having a good night, timely sleep for about 8 hours. So if you sleep at 4 o'clock in the morning for 8 hours, it is not as effective as sleeping maybe 10 o'clock, 8 o'clock, and getting up at 6 o'clock or 7 o'clock. Bariatric surgery has been a great boom for the patients as well as for us as a treating team, because before bariatric surgery, there was very little to offer. And if you look at the history, I think Raj Kapoor and so many other persons, Gabbar Singh, etc., they all died because of morbid obesity, because there were no options so far available at that time. But now we have got this option, and I will always like to emphasize that the bariatric surgery is a life-saving surgery. Bariatric surgery is a surgery also metabolic, it reduces the metabolic storm of the body, something like diabetes, dyslipidemia, high cholesterol levels, blood pressures, and so many other things. So I feel that bariatric surgery is one of the very important landmark in the management of the obese patients. And I will equate it to the landmark of coronary artery bypass, CABG. Before coronary artery bypass, most of the patients were dying in the second or third heart attack, which we don't see now. So I feel that the importance of bariatric surgery is as good or as crucial as it is the coronary artery bypass in the cardiac patients. The basic concept, these are two basic concepts on which the bariatric surgery works. One is the what we call is a restriction. That means that you reduce the amount of food going in, whether you do willingly, whether you do physiologically, whether you do with the support from your instructor, family members, or when we talk about surgically, when it doesn't work, then surgically we reduce and restrict the volume of the food which you can take, which the patient can take, and that is by reducing the volume of the stomach where the food is accumulated, where when we eat, it goes into the stomach. So we reduce the volume of the stomach. That is one concept. Another concept is we reduce the absorption of the calories. That is bypassing the gut, a particular portion, maybe 30, maybe 1 meter, maybe 2 meters, depending on the type of operation which we are doing. And when we combine these two, this third category is the combined procedure. So if we talk about the restriction, I think the balloons and the sleeve gastrectomy belongs to, not purely, but yes, mostly the restrictive operations for the management of obesity. Then if we add the malabsorptive part, then is our classical gastric bypass or one loop anastomosis, what is popularly known as a mini gastric bypass, or maybe there are many other procedures, biliopancreatic bypass, SADI, so many. So we should not confuse. I think the banding and gastric sleeve are primarily the restrictive procedures. Gastric bypass is a balance of combined restriction with malabsorption, and SADI and biliopancreatic bypass are purely malabsorptive procedures. But the most common and most popular, of course, still remains gastric sleeve and gastric bypass.